I'm Larry Kalvig, founder and CEO of the Haven Financial Group. Thanks for listening. Feel free to give us a call at 612-504-8400 or havenfinancialgroup.com. Kim, it's a big time of the year. It's annual enrollment, Medicare. It's great to have Glenn Ramey, our expert in-house, in addition to Isabella. And great to have Glenn. And let's talk healthcare.
Let's do just that. Glenn, it's great to see you again.
Yeah, thank you. Great to see you as well.
Yeah, absolutely. We were kind of talking about, the fact that Gen Xers, they're really starting to think about their retirement. And so this enrollment period right now, that's very important to maybe some of our baby boomers who are already in the system, but Gen Xers, they're thinking about it very seriously. So let's just talk first about them, because what I think is interesting is that people who were born between 1964 and 1980, late 50s, in their 40s, these folks are expected to live longer. And so that's going to have a real impact on their healthcare.
Yeah, absolutely. The old adage, we practice medicine, right? We haven't perfected it yet. So new medications, new surgeries, new technology is coming out, and all that is going to mean longer lifespans for us Gen Xers. Absolutely.
So what might be different for Gen Xers when it comes to healthcare and retirement than maybe the generation before them, the baby boomers?
Well, again, expecting to be on that insurance program for a much longer period of time, and the risk of long-term care needs becomes more significant the longer we live, right? It's now not just family history that boils down into whether or not we'll have a long-term care event. It's just living longer. One staggering statistic I can share with you is a condition like Alzheimer's. At 65, 1 in 10 people will be diagnosed with that. At age 90, 1 in 2. 50% of that population is suffering from some form of cognitive decline, right? So these longer lifespans don't necessarily mean 100% healthy living that whole time.
All right. So now that you've given us all this great news.
Of course. Yeah. Always the bear. Yep.
Oh, but right. That is your job. So you're doing a fine job at it. Let's talk about how important it is for people to start planning sooner rather than later with these kinds of ideas in mind.
Yeah, so the insurance industry would tell us that our 50s is the right time to start having that long-term care conversation about what we will be doing and how we'll be funding that care. And there's two reasons why they're going to make that recommendation to us. The first is cost, right? The younger we are, the less costly it is to have and maintain that type of insurance. But more importantly, it's a health underwritten option, meaning that health history, things that are in our health, could interfere with our ability to qualify for those types of coverages. So they estimate in our 50s, we haven't yet had many of those major health occurrences that could interfere. And if we choose to try to wait till we're within our 60s to try to plan, we're now increasing that likelihood that there's something in our health that is either making it more expensive to plan for long-term care, or it could even limit our options because we don't qualify for those long-term care plans.
So walk us through, Glenn. I come in and I sit down with you, and I'm with my husband, and he and I are 55 years old, and we want to make sure we're in perfect health, but we want to make sure that we're going to get the biggest bang for our buck, if you will.
Sure. So I'll say there's several factors that I would look into. First off would be obviously budget and expendable income in retirement. How much of that cost can we handle ourselves, and how much do we want to insure against? Are we saved appropriately but not well enough to cover long-term care? So we're concerned about preserving our assets. That might dictate a financial vehicle for long-term care planning that's going to protect the money we have if we still have to have the state assist us in paying for cost. Otherwise, on the other end of that spectrum, if we're really good savers, there's long-term care options that don't even have premiums that we have to pay, but just require we set aside some of our own money for later, and they'll leverage that money against those long-term care events for us through something like a long-term care annuity.
It's a very expensive prospect, though.
It is, but we're talking about a lot of cost, right? So there are some averages as of today for you. It's currently $10,000 median cost in my state for a nursing home, long-term care facility. It's $120,000 per year in cost. Where average stay in a long-term care facility is 3 years. That's $360,000 in cost. That has a 50% likelihood of happening to us based on the long-term care statistics. Now, if I put a modest 3% growth on that cost and project that out over 20 years, you can double those numbers I just gave you.
All right, let's talk about healthcare in general, and most specifically, maybe folks who Larry and I talked about a little bit at the end of the last segment. People who maybe are already on a healthcare plan. This time of year is especially important. Walk us through some of the steps that people need to take if they're already on Medicare, but of course, open enrollment is now.
Yeah, so this year, as I say, a real transitional year for Medicare. For the first time in Medicare's history, there is now an out of pocket limit placed on prescription drug plans in Medicare. Every plan out there is now going to have a 2,000 out of pocket cap. And this has meant adjustments to plan formularies, adjustments to benefits. Heck, in our state, we had 21 drug plans last year. We now have 14 for consumers next year. So there's been a consolidation in available options as well. So today I'm taking clients through first their medication coverage. Is there a way to save them money or make sure that their current plan is going to cover their meds? And if not, switching them over to one that will. And then since all these other things are happening, benefit designs are changing, doctor networks are changing. I know there's a lot of news right now about insurance companies losing providers out of their provider network, and that isn't just a state specific problem, that's happening all across the country. So unlike normal years where someone could have been complacent on their Medicare and been okay, this is one of those years you really need to pay attention to.
And how specific to the state you live in are some of these, some of these coverages?
Almost all of it, right? So you're always going to buy insurance out of the state that you live in initially. So your very first purchase in Medicare is always going to be where you're residing out of. And then as you move, many Medicare plans are zip code specific. So it's not even a move to a new state, but maybe I was in a metro area and I moved to a more country area now to enjoy my retirement years. And I'm in a zip code now where my current plan isn't offered. I'd be required to change to a new plan, and that's offered in that area.
I feel like this could be very overwhelming for people.
I would agree with you. Many people will say that when talking with me, that this all seems extremely overwhelming. And I would say, just know that there's professionals like me out there in your area that are looking to help you. We don't cost anything. We're compensated by insurance companies to help you enroll. So we're not looking to get a fee charged. We just want to help people understand their options and make good decisions.
And tell us, Glenn, I'm seeing it on TV constantly, call this number, and it all sounds great and fine. But that's not necessarily the case. And what is the deadline here?
So the deadline is December 7th for Medicare Advantage and prescription drug plans. It
Okay.
started on October 15th and goes all the way through December 7th.
Okay.
Yeah.
And
If you
how
have
quickly do you need to get it taken care of?
I'd say as early as possible. Again, considering this time of year is, as I said, a really transitional one. Many like myself are very busy trying to help our existing clientele and new ones transition. So I would encourage you to reach out to your person or reach out to us ASAP to get booked so you have an appropriate time on your calendar to get that done before the deadline's over.
Glenn, do you need to take a different approach if this is the first year you're getting in?
Yes, I'd say the first year is the most important decision you're making in Medicare, right? Because some of these options might be a lifetime decision for you. It's really important to make that first one the right one.
Okay, so what are some of the decisions you're trying to make?
Yeah, so it's that first choice between whether I want to do a Medicare Advantage plan, also called
Mhm.
Part C by Medicare, or a Medicare Supplement plan, also referred to as a Medigap policy. And it's that second one that I give the warning to is this option's only guaranteed to us within that first 6 months of signing up for Part B of Medicare. And if we did not choose that option within that time frame, we're now underwritten in the future to have it. If a client approached me and said, Glenn, which plan in Medicare pays the medical bills the most and leaves me responsible for the smallest dollar amount out of my pocket to have my medical bills covered, it's going to be the supplement plan. But we can't wait until we're sick to have it, right? That's that
Mhm.
one that if we don't do when we're first signing up for Medicare, we might never have the right to have that as an option for our healthcare. So again, that
Okay.
first decision, so important.
Okay, so give us some age, let's understand the ages here and when we need to be making these very important decisions.
Yeah. So for most consumers, Medicare is going to start at age 65. The birth month that we are born in will be the starting date, the first of that month. With one exception, if we're born on the first, we get to start that plan a month early. And Medicare is going to give us a 7-month enrollment window, 3 months before that month and 3 months after it, to get all of my Medicare in order. Otherwise, it would require being on Social Security disability for 24 months or having certain conditions like ALS or kidney failure that could qualify for someone for Medicare at any age.
All right. So now, for those of you listening, if this sounds overwhelming, you just heard Glenn say it can be overwhelming. There's no two ways about it. And Larry, I think you would agree with that. I mean, this is quite a process.
My head still spins every time I hear Glenn talk. And for the listeners, it may not be fun to look forward to a time in life when, healthcare will be a large expense for you, but planning carefully now for those expenses, your options that are out there, how are you going to afford those costs? Now is more than ever is planning coming into effect, maintaining your health, increasing your quality of life. If your head is spinning regarding healthcare, long-term care, these are not fun discussions, but they're important discussions. So give us a call. Your situation may be unique just to you. We hear all kinds of situations, but creating a strategy that best goes together with the rest of your retirement plan. I always say all the retirement puzzle pieces, retirement more than ever, those should be coordinated. They should be working together. And no doubt, healthcare and long term care should be part of a retirement plan.
612-504-8400. That's the number. If you'd like to go in, sit down with Glenn and talk a little bit more about some of what we have just kind of scratched the surface about here on the show this morning, please give them a call. It's 612-504-8400. You can go to havenfinancialgroup.com. Glenn, it's always a pleasure. I'm so glad that you stopped by and helped us out.
Mine as well, Kim. It's always a pleasure, and I look forward to talking to you again soon.
All right, terrific. Larry, when we come back, let's talk a little bit about the unique retirement tips that you have for these Gen Xers. This is the Haven Financial Group Radio Show.